Well, for his thoughts on the issue, we are now joined by Alex Munter, the president and the CEO of the Children's Hospital of Eastern Ontario, also known as CHEO in Ottawa. Alex, thank you for taking the time today.
Nice to see you again, Michael.
Now, there's a lot to talk about here, but before all else, I did want to get your thoughts on this current impasse. The provincial government's looking for more funding, Ottawa trying to push for reform. And I appreciate that it doesn't really have an immediate impact or bearing on what you're having to deal with right now on the ground. But what do you make of this stalemate?
Is it a stalemate, or is it just the theater that we always have in Canada before we land on a federal-provincial agreement? So they're talking, and hopefully they will come to a conclusion. I do think most healthcare organizations, certainly Healthcare the Ontario Hospital Association would say we do need a greater federal investment in healthcare, and I think there's a recognition that the federal government will want to make sure that there are outcomes for that investment. So I'm hopeful that they will land on a deal that will allow organizations like ours to do what we will need to do over the next number of years, which is really catch up on a backlog of care that has been building for many, many years and that has become particularly acute now.
Well, let's pick up on that point then, because there is a greater discussion to all of this. And again, this has to do with what you are having to deal with on the ground. Your hospital has had to turn to the Red Cross recently for help. What is that like then, right now at CHEO? How is the situation, and how's it been for the past few weeks?
Well, the problem at CHEO, it's the same problem at every single children's hospital across the country, which is that our organizations were simply not built for this kind of demand. For example, our emergency department was built for 150 kids a day. There's not a single day this year that we've had fewer than 150 kids here. And so at the moment, we are seeing record numbers of sick babies, sick children who need to be hospitalized due to respiratory syncytial virus, RSV, flu, COVID, as well as, of course, all the other reasons that kids need to be admitted to hospital. And so, we have 2 pop-up ICUs. We've converted a medical day unit into an inpatient unit. And when I just came back from that unit, it's not unusual to run into a neurologist or a cardiologist or nurses from our various clinics staffing all of these extra beds. And the problem with that, of course, is that they're not in their clinic. They're not in their OR. They're not delivering the planned and scheduled care that kids and families have been waiting for a long time. So there's 2 surges to think about. There's the surge today, this week, this month, in kids with acute viral illness. And there's the slow motion surge that's building of kids that need an MRI or a specialist appointment or developmental therapy or surgery that are not getting it. And that's the thing that we're most worried about in the children's world.
Well, talk about that, because I do wonder about the impact. We talk about the impact whenever an adult procedure is delayed. What impact does it have on children to have their procedures delayed and or even transferred so far away from home?
Well, so a child that needs dental surgery and that can't get it will can affect their language acquisition if they're a young child. A child that can't sleep because of tonsillitis and can't learn, it affects their development. It affects their whole family. A child with a disability that needs physiotherapy or occupational therapy and doesn't get it has decreased function. May affect the trajectory of their life, and I could go on. Here's the thing that I think would startle most people. In Ontario today, and I think it's similar across the country, but the Ontario data is the data I know best. In Ontario today, in most parts of Ontario, for most types of care, kids wait longer than adults. Let me repeat that. An adult who needs an MRI or who needs eye surgery or who needs mental health counsel will get it much more quickly in most parts of Ontario than a child or teenager that needs those same kinds of services. And that's because we have an undersized child and youth health system. And so I'm hopeful, and I know my colleagues across the country, we were just talking about this yesterday, we're hopeful that the silver lining to this surge, the silver lining to the pressure and the stress that everybody is experiencing, kids, families, healthcare providers, is that finally, we've been saying this for years, but finally I think we've got much greater attention and focus on the fact that we have an undersized child and youth health system for a growing population of kids. There's going to be 1 million more kids, over 1 million more kids in 20 years than there are today. And we need to right size the pediatric health system in Canada.
We're quickly running out of time, Alex, but paint that picture a bit more for us. If we are undersized, what numbers are we actually dealing with here?
Well, I think here in Ontario, just in terms of dealing with the backlog, we're talking about around about $1 billion investment over the next 4 years, which is, in the context of a $75 billion provincial budget, we think manageable cost. And I think the key principle here is we don't want kids waiting longer than adults for care. We want kids to get the care they need when they need it, so that they can be kids, that they can go back to school, they can learn, they can develop, and they can contribute in future to our community.
Alex Munter, thank you for this. Really appreciate the time.
Good to see you.